the whole idea of the initiative is to get it as, let me see if I can get this going, is we intend to have a web-based program that you can access very easily and participate in the program as we, let me get this, I'll talk in a little while. What is this? Obviously. Where is the symbols? I can't get it here. The next symbol is... Obviously, I need help. You want to have a look at it? I don't... Come on, guys, I need help. I don't see where's... Pardon? No, what? No, I need to get the dot. Yeah, the dot. I don't see it. It's here. Yeah.
Oh, that's it.
Yeah, see, I can't get it. Oh, I see .org. I'm going to put in the org. Let me see if this works. Okay, let's see if it goes. Okay, here it comes up. What we intend, what I'd like to do is show you the Pediatric Sepsis Initiative, as I said, and what we intend to do is put, there will be some modifications, but we intend to put this on the site, and then we hope that you will access it and participate in the initiative. But what we'd like to do, the problem is that, as far as I'm concerned, this is only going to be successful if we all participate in it, and if we all, obviously I don't have a login here. Let's see if it's going to work again. Pardon? Is the email? Oh, sorry, yeah. Shows how much I know at this time. Where's the at now? Oh. Don't see the symbol again. This oh, is that it? Where's that?
It's up here.
Is that it? Yeah. Okay.
We're in Europe. That's the problem.
Hold on. Stand here yet until we get it done. And then, is that the dot? Where's the dot again? Is that it?
Yeah, you did it.
Mm. Let's see. Let me see if that works. Change your facility. What does it mean? Well, obviously it's not going to work on this computer. Oh, sorry. Yeah, that's correct. Yeah. Oh, let me go back. All right. Let's create a new facility. Facility name, let's say UBC. Country, Canada. C-A-N-A-D-A. Is that it? Enter. Go ahead. Scroll on. Okay. What I can tell you while I get some help here from Peter, what it is, we're putting together, as you can see, an administrative bundle such that anyone who enters the site and create a new facility will enter the institution, state, etc., and then where the patient, where the facility is, whether it's a clinic, whether it's a hospital, whether it's an ICU. The administrative bundle that we have here will give an idea of what is available in your facility. And when we do that, as you can see, it starts from very simple measures containing oxygen, IV catheters, vitamin A supplementation, immunization, potable water. Many of the things that you have heard in the previous lectures from Dr. Bang, you've heard it also from some of the talks that Joe has given and I have given. So it gives you an idea what is available in the region. It gives you an idea what is available in the specific institution. Now, after creating this administrative bundle, then what you would do next, this will be stored in the computer or on the website such that if you go back at any time and you just type in institution, this would come up and you'd be able to bypass it. Once you've gotten beyond this, and if you will fill out these, etc., the next stage will be you submit the form. I guess in the interest of time, I wouldn't take much time, but this form will be submitted, and then you will have a screen that comes up with 4 different bundles. And the bundles will be based on the economy of countries as well as the sort of expectation as to what we expect your treatment protocol should be. For instance, we are making such a way in a stepwise manner such that countries with or regions with mortality less than 5 mortality of greater than 30 per thousand will have a specific bundle, and it will be simply the bundle concerning immunizations, vitamins, and IV fluids, oral fluids, and IM antibiotics if necessary for sepsis, and oxygen. And what it's going to be is that those are the bundle. It represents what there's good evidence for based on some of the work, as we mentioned with Dr. Buta, etc. So this is what is going to come up. As you can see, Group A, again, and this now gives you an idea as to, you put the patient's age and years, name, etc., and then you can see the clinical practice bundle that you need, you can subscribe to. For instance, in this case, you can see, based on what we've said, your parents' education, tachypnea, feeding, etc. Now, this is going to be changed based on your input this session here, and in other words, to make it more relevant for you. So there'll be a clinical practice bundle, and then there's, obviously, we would like to see an idea of outcome. Now, the only way this will be successful is if people fill out these forms and submit it. And obviously, I think we've had a lot of discussions about it, and I hope this will raise there will be more discussions at this time. The intent of this is not a research tool. Over a period of time, obviously, it's going to be modified based on your input. But the intent really is to raise the profile of the treatment protocols for patients in different environments. And ultimately, hopefully, we know that there are limitations in various areas, but this will raise the issues of what needs to be done. As you heard from Trevor, you heard from Joe, this is only one aspect of the sepsis initiative, and I think that what we intend to do is do other things. There'll be educational material. There'll be all the videos that we have filmed over the last few days, and what we'd like to also have is a dialogue area whereby people can enter, ask questions or something that is relevant to them, and generate more ideas. Now, so as you can see, the first one was greater than 30 per thousand. This is less than 30 per thousand. It gets a little more advanced treatment here now with IV fluids, etc., based on the what we see in the ACCM guidelines and based on what the WHO has recommended for community hospitals. So what we're trying to do is that with the patient who are septic, we realize that if I go back to this again, and you can see, let us take the industrialized developed nation, that may not be relevant for many parts of the world. You can see the industrialized developed nation, we go right down to the issue of having CRRT, some may have plasma exchange, ECMO, high frequency oscillation, etc. So the fact is, as the complexity of treatment increases, obviously your resources also increase. So our task is really, we know in the industrialized, developing and industrialized developed countries, it is sort of very much more easier to generate protocols, start research, etc. But our task, we feel also, is in the A and B, to educate, to try and raise the profile of bundles, and then hopefully we can make inroads into getting resources or helping our colleagues with resources. Now, what I'd like to say is, I said, with this also, when you enter the site, what we'll have is an email link, and you can email me, one, with suggestions, as I said initially, but also I'm sure some of you have heard about the ambassadors list. We have an ambassadors list, and what we'd like is anyone who would like to participate in the continuing discussion and the issue of raising the awareness in different parts of the world, policy generation, etc., please feel free to email me and join the ambassadors list. The intent of this is really to, as I said, is an educational tool. Secondly, those who are interested in and those who enter the data will get some reports, scorecard. We understand, many areas it's going to be difficult to enter. We understand people may not enter all at the beginning, but we hope that over periods of time that it will become a more effective way of at least getting an idea what is happening in various areas. So this would be part of it, and there would be, depending on what you want, we would have other educational material. Hopefully we can have more resources, start research questions, etc. I think I'll just stop there now and turn over the